Hey, what's up, guys? It's Dave. Today is May 1st, and we are going to do a quick COVID 19 update on everything for first responders that we've been dealing with for the last month or two here. So, first off, some numbers for Virginia. We've got over 100,000 people that have been tested. And here in the New River Health District, we've got over 1,800 tests that have been done. From that, we've got 75 cases that have come back positive here in the New River Health District. 56 of those are here in Montgomery County. And based on those numbers, we are seeing about a 4% positive rate. So, of everybody that we are testing here in the New River Health District, only about 4% of those are actually coming back being positive for COVID 19. Comparing that to the state, the rest of Virginia right now is at 16%. So we are down at 4%. And a big reason behind that is that we have such good testing options here, and we've been doing that for a while. So it may not seem like there's tests everywhere you go, but compared to the rest of the state, we're actually doing really good for our population here. So only about 4% are coming back positive. And of those, we've only got 10 out of the 75 total that have had to be hospitalized, and one that resulted in death. So, looking at those numbers for us right now, for the New River Health District, all of the cases that we've had have been people that have been over 50 years old that have been hospitalized. Two were between 50 and 59. Two were between 60 and 69, and then the other six were over 70 years old. So that just gives you a little breakdown there. And we're pretty much on track with the rest of the state for hospitalizations versus, who can work it out at home. So we've got about 13% here in our area. The rest of the state showing 14% right now. For the death rate or the mortality, people passing away from this, our health district, now to be fair, our sample size is only one, so the math is a little screwy there, but we're looking at just over 1%, and the rest of Virginia right now is at 3.4%. So we're doing good there too. Looking at the map here, this has been updated since we last talked, so you can see all of the cases, hospitalizations, you can break it down by all of that. The other cool thing that you can do now is do a per capita, so it looks at based on the number of people where we stand. So you're still seeing that higher in the other part of the state there, but this is kind of a nice way to compare it that's a little bit more accurate for what we're talking about. And then here's the number of cases, kind of on a moving average, so you can see that it's slowly starting to kind of taper off there as far as that curve. Popping over here, so this is the cases that I was telling you about here in the New River Health District. So we've got 75 total, 10 that have been hospitalized, and one fatality. For the fatality, you can see that person was between 70 and 79 years old. And for the entire state, you see that really, of course, I'm going to break my computer here apparently. You can see that most of these are in that older population. So really that high risk older population is the ones that are at the most risk here from this disease. And there's the other stats and demographics, as you can see. And then popping over here, we've got some numbers per health district, and it breaks it down for each. So I guess every time I click this, it's going to reload and update. But here's ours for New River Health District. So Floyd's got 3, Giles 4, Montgomery County 56, Pulaski 9, and Radford 3. And the health task force that we are part of, it is spreading out and doing some more testing in some of these other counties. So we'll probably see those numbers go up a little bit. Like we've been saying all along, the more time the more people we test, the more cases we're going to see. But that's just giving us some more realistic numbers where not every locality is able to get that. And because of that, you can see our numbers as far as hospitalizations and deaths are way lower than the rest of the state. And that really goes back to the testing. So there's just kind of some more numbers there. As far as hospitals are going, so our hospitals are all in pretty good shape. We're meeting just about every day with leadership here in our local hospital system, so both HCA and Carilion, and talking to them. They're seem to be doing well. Today they're actually starting back up with elective procedures, like elective surgeries and outpatient stuff. So they're doing good. The total number of cases, compared that to the total recovered, and then looking at capacity here, which has really been what we've been worried about and watching closely the whole time. So we're doing pretty good on capacity. Ventilators right now, we're only using about 20% of our total available ventilators. So we're good there. We've got over 5,000 hospital beds available. Let's see what else we got. So talking about testing. So with testing in our area, it is available. We do have testing for, especially for first responders that need it, or healthcare professionals, high risk people that might be sick. But really at this point, we've got the capacity to do even more testing than that. So it is open to public and to people that aren't sick or aren't symptomatic as well. If you have an interest in getting tested, it's going to be that standard PCR test, the nasal swab. But we do have a good capacity of those tests. We've got them available, and we're doing testing about 2 to 3 times a week at the drive-in test centers, in addition to the hospitals and everyone else. But if you're not sick, you don't want to go to the hospitals for a test. You just want to coordinate to get through one of these drive-through tests. So that is available. And we now have Fralin up and running with Virginia Tech. So we're actually getting results back way quicker. We've got a site here in Blacksburg, and then also one out in Roanoke that can be running these tests. So their big priority right now is for first responders, healthcare people, but their capacity is growing pretty quick too, so they're going to be able to run these and get them back way faster, which is awesome. So that is up and running now. That's happening, and we're getting results back, sometimes as quick as the next day, usually within a couple days, where for a while we were seeing like a week plus. So we're having good results there. For PPE, so personal protective equipment, most of the areas in our region are in good shape with personal protective equipment. All of the agencies that I'm involved with were good. Our county's in a good spot with that. If your agency doesn't have personal protective equipment resources, make sure you reach out to either the health department or our task force if you're local, and we can get you figured out there. Another really cool system or cool thing that we are seeing that's actually in place right now and should go live early next week is this Battelle system. So we've known about this for about a week, kind of getting things up and running and get the logistics figured out. The governor actually just talked about this about 20 minutes ago in his press briefing. So now it's kind of more public that we can share it even broader. This system is designed to clean and sterilize personal protective equipment, specifically right now with the focus being on those N95 masks. So for first responders, healthcare providers, really any system like that uses N95s, this system is going to be able to clean and sterilize them and get them back in service quickly. So if you want to check out their website, it's just Battelle, BATTELLE.org, and then there should be a little link to jump you over to the COVID-19 stuff. It's going to talk to you about what to do and how it works. There's a little video here I'm not going to play because it gets a little funky doing the video inside of another video, but I'll share the link to this if you're interested. Check that out. It walks you through how it all works, but basically It just uses the hydrogen peroxide vapor, and they're these big metal like storage bins. And they'll run it. It takes about 4 hours to run. They can actually process up to 80,000 N95 masks every day. So capacity is not going to be an issue with that. And they've already got all of the logistics for transport and for logging and how to do everything with that. So again, that's going to be a really nice option, and that can clean an N95 mask up to 20 times. So each of these pieces of equipment can be cleaned, sterilized, and got back to the same person and reused up to 20 times. So it's a cool system, and there's right now they're looking at having 3 in the state. One of which is right here in Blacksburg on Virginia Tech campus, and that's actually the first of the 3 that are going to go live. So we're going to have the first one in Virginia and West Virginia to be able to use this system. So looking good there. What else? So capacity, and kind of just looking at the numbers here. So this is the deaths per day projections for COVID-19 here in Virginia, and the U.S. stuff matches this pretty well. So we've already kind of gotten towards the peak there of what we are expecting. Now, obviously, that can shift a little bit, and we might get some other little spikes here and there as things open back up and we start to do more. So we do still want to maintain the same cautions and keep each other protected there. However, what we were really concerned with is the spike that was going to potentially use up our infrastructure and our capacity to maintain and manage that. So that's really the focus, is mitigating that. Hospital use, so again, we're in pretty good shape there, and this is showing today where we're really kind of at the apex of that peak of what we're expecting, that to pretty much level out within reason here over the next week or two. So we're in pretty good shape there. Finally, the last thing I'm going to cover is the quick updates for this week for the first responder guides. So not a lot has changed, so I'm not going to go through this in depth. You can watch the other videos if you want to do that. But make sure that you are looking at the most current version of this. So we're updating this once a week now, just because things aren't changing as rapidly as they were. When we first started, we had to update this daily. Luckily now we don't have to do that. So every week we're updating it. You can go to the website. It's bit.ly/COVID911. Make sure that's all in capital, and that will pop you over to the current version of this guide, or you can just hold your smartphone up to the little QR code there and it'll pop you to this as well. Public interaction, so no big change there. So fire and law enforcement, we're still using surgical masks and eye protection with all public contacts, and we want to avoid having anybody cough. We don't want somebody that's got a fever, trouble breathing, anything like that. If we have that, then we ramp up to these other physical contact precautions as well. Personal decon, no changes. Make sure you wash your hands, clean your gear. For the vehicle, make sure you air it out. Otherwise, no real changes there. Nothing else on this page. This actually the most important updates that have come out over the last week. This is in the reporting to work and when you should or should not be at work. So this is really the most important thing here. But in the past 24 hours, you should not be coming to work if you've got a fever, chills, shaking, trouble breathing, sore throat, cough, muscle pain, headache, or if you've lost the sense of smell or taste. So that is a much longer list than what we had on here last week. So make sure that you look at that again. So fever, chills, shaking, trouble breathing, sore throat, cough, muscle pain, headache, or the loss of smell or taste. Any of those things in the last 24 hours, and you should not be going to work. And you should be free of those things for at least 24 hours before you do go to work. Otherwise, not much has changed there. Post-exposure stuff, no real change there. Again, making sure if we're wearing our mask and goggles, then we are low risk across the board, with the only exception being if they're sharing fluids with us, like coughing on us or anything, then we may also want to wear a protective gown. And if we don't, then we're going to need to decon that or shower or change. But otherwise, we maintain that low risk factor. High risk, no big differences here. Rapid source testing, luckily that is available to us, and even more so now than it was, so that is good news. And of course, all of these resources, they are all still the same, and the frequently asked questions, not a lot of change there either. But check that stuff out, and if you have any questions, feel free to leave it in the comments, and I will try and get you an answer. And then lastly, hopping over to the EMS version of this. So for EMS, this is just kind of geared a little bit more towards us. Let's see, wear COVID PPE on all calls. So across the board, we're wearing a mask, we're wearing goggles or safety glasses, and then we're putting a surgical mask on the patient as well. So we decon after all calls, and we use this guide. Decon after calls, so this is not changed, but just remember we do need to be doing this after all of our calls because we never know. And also there's so many patients that we may possibly transport that are asymptomatic and don't even know that they have this. So we want to carefully remove our PPE, wash our hands, wipe down our gear, and air out the vehicle. So we want to be doing that across the board. And reporting for duty, just like with the fire and law enforcement version of this, really the most important update here is the additional symptoms that we need to be concerned about before going to work or before going to our shift. So you haven't had in the last 24 hours fever, difficulty breathing, chills, sore throat, cough, headache, muscle pain, or loss of taste or smell. If you've had any of those in the last 24 hours, you should not be going to work or going to your shift, and you need to make sure you let somebody know and you don't come back until it's been at least 24 hours since any of those things have happened. Potentially longer, but at least 24 hours. And then obviously a diagnosis of COVID or somebody else that you live with that's been diagnosed. Medical care, not really any changes here. If it is, this is really just kind of going over some of the basics of what we want to be cautious with, the high risk factors, some of the care changes. Again, we're kind of watching, going away from oxygen if they're satting 96% or better. IV fluids, you really only want to be sticking them if you need to, and then minimize that fluid bolus if you can. Consider epi instead, but we want to avoid dopamine. Avoid NSAIDs. So if we have fever, we're going with Tylenol over like ibuprofen or something like that. And then we also want to be cautious about steroids. So locally we carry Decadron now, so we're going to avoid that. And then the biggest risk for us are these aerosolizing procedures or these AGPs. So we want to be really cautious about any kind of procedures like this. So NEBS, CPAP, CPR, BVM, intubation, suction, anything like that. Sometimes we may need to do it, but we want to do it carefully and make sure that we're fully protected. So in addition to the normal stuff, you might need a full N95, maybe a face shield, gown, and really focus in on minimizing these things if you don't need to do them, and use caution. If they can wait till the ER where we can do that in a more sterile environment, that might be best. And if we are doing these things, anybody nearby needs to have that full protection. And if possible, we want to do that on scene or outside. We don't want to do that in the ambulance if we can avoid it, and make sure we're using the exhaust fan and stop that procedure while we're walking through the ER so we don't potentially contaminate anybody else. tier disposition tool. So for our agency here, we are still in this tier 1 or average demand. Our call volume has kind of stabilized a little bit. It's still down just a hair, but it's about what it normally is. So we're just in this normal response plan. We're tier. And for PPE, right now for our agencies, we're in this contingency plan, which is a slight modified slight modification to what we would normally do outside of COVID-19. So we're still in pretty good shape with PPE, but we want to be careful with it. We don't want to burn through it too quick. We want to reuse it when we can. So for masks, we're reusing surgical masks during our shift unless it gets, soiled or torn or anything like that. But otherwise, we can keep using it if we don't have any of these like really high risk situations. So we can wear it for up to our full 8-hour shift, but we can replace it otherwise. And we want to put some kind of a cloth face covering on the patient, whether that's an actual surgical mask. Most of the hospitals do prefer that. So if you have enough, great. But if not, any kind of cloth face mask is fine. Eye pro, so we still want to be wearing a full face shield or goggles or something to cover our eyes, and then decon that anytime it becomes soiled. And gowns, if you have a gown, you can use it, especially if you're doing those high risk procedures. And if it's washable, then you're going to wash it after each use, or you're just going to get rid of it and get a new one. So that's pretty much where we're at for the most part with most of our PPE. Post-exposure stuff, no changes here. And return to work, no changes. The resources are all still here and the same. Some examples of what these different kind of masks are. And our frequently asked questions. So that about wraps it up. Hopefully that was helpful for you. If you have any questions, let me know. Just leave it in the comments or shoot me an email, call me, text me, whatever, and I will try to get you an answer if I don't have it. And otherwise, we'll bring you another update sometime next week. Thanks, guys. All right, guys, thanks for watching. If you click subscribe, you'll get a notification every time we upload a new video with this topic. Also, make sure you check those links because this information does change rapidly. So check the links, you'll get the most current info. And if you have any questions, leave them down in the comments and I'll try and get back to you with an answer as soon as I can. Thanks.